All right, group, so this is our first real set of notes. So anything that you see on this video or in the slides, make sure that you write it down because that is going to be important information that you need to start studying for. So our notes today are over anatomical terminology. We can also refer to this as directional terminology. And then this will be for our class lecture August 23rd or 24th, depending on if you are an A-Day or B-Day. Our learning goal, don't worry about where it says page 11 up there, that's for something else, but learning goal is I will be able to use Greek and Latin roots to break down anatomical terms, and I will be able to appropriately apply these the terms related to anatomy. Anatomy uses a lot of different phrases and words, and so we need to learn those. It's like learning another language so that we understand what others in the medical field are speaking about when they refer to these things. So first thing that we're going to talk about here is just putting words together. So anatomy will use Greek and Latin roots for the most part. And this, again, it's as part of to keep continuity across the board. So where we don't want it to be anything that's a regional term. So in the same way that, for example, in Nebraska, most people call a carbonated beverage with syrup in it pop, but if you go to other parts of the United States, others will call it soda. Some people just refer to it as Coke. And so instead of having all of these different regions with all of these different terms, we try to use these Greek and Latin terms put together so that we all are understanding what each other's saying. So to make these words, we put prefixes and suffixes and roots together. So prefixes are going to be before the word. That's why where that word pre comes from, before. The root will typically be in the middle, or it will be like the main purpose of the word, and then a suffix will come at the end. Okay, there we go. So the very first thing that we need to know as we are learning anatomy is what's called anatomical position. So anatomical position is the body is completely straight up and down, so nothing is bent. Palms are forward, so your hands are, you can kind of see it, kind of like this. There we go. They're kind of like this, so thumbs should be out and away from the body, and feet are slightly apart. Anytime we use the words left or right, it will refer to the person, the body, the specimen. It refers to their perspective. This is one of the concepts that's most challenging for students because typically if we say left, you look to your left, which is the, if you're looking at somebody, it's the opposite person's right. So that is a concept that we do need to work on, and we will practice in class, but left refers to the specimen's left, right refers to the specimen's right. Getting into directional terms, it is exactly like it sounds. This is going to be terminology that helps locate or place something. So to really get into that, we first have to, we're going to start big, and then we'll actually work our way to smaller. So two fundamental divisions of the body is axial and appendicular. Axial you can remember because it sounds like the axis, or you can also remember like the axle of your car. It's the middle in between two tires. So the axial part of the body is this part right here. So it's the head, the trunk, so like the chest and the abdomen. So it's this part right here. Okay. Appendicular you can remember because of the word appendages. Appendages is anything that connects to a central location. So that'll include your arms and hands and fingers, and then also your legs and feet and toes. So it is your limbs. More directional terms include the following here. So this is going to be, it's directions, it's how to get somewhere. So instead of saying up or down or closer or further, we need to be careful because, again, we have to remember that we have to be very specific, and we don't want to leave anything open to interpretation. So when we use our regional terms, and particularly our regional directional terms, superior and inferior are opposites of each other. If I have a superior, that means they are above me. So, for example, Miss Johannick is my curriculum specialist. She is my superior. She's my boss. Inferior means below, so it's like be less than. Ventral and anterior for humans mean the same thing. It means the front. If you go into veterinary sciences, they will actually mean slightly different things, where ventral will mean of the belly and anterior will mean towards the head. So because animals are on all fours, they do have a slightly different, but because we as humans, our belly and our head are in the same location or the same plane, ventral and anterior will mean front, dorsal and posterior will mean back. Medial and lateral, again, they are opposites of each other. Medial means towards the middle. Lateral, so if you have lateral movements, that means you're going side to side. Intermediate means it's going to be kind of like in the middle of the middle. So it kind of cuts right here. Proximal and distal, we will practice these a lot more in class because they are something that you have to kind of wrap your mind around. But proximal means it's going to be close to the point of attachment, or in this case, the joint. So proximal, how you would say this is you would say, my bicep, which is this big muscle right here, is proximal to my elbow. See, it's closer to the point of attachment, the joint, than the elbow is. And distal means away from the point of attachment. So again, in this case, we could say my wrist is distal to my elbow. Okay. Superficial is exactly like it sounds. It means on the surface. You're external. If you are somebody who is superficial, you really worry about what's on the outside and not so much what's on the inside. Deep is going to be below the surface. Okay. You have all of these fun axial body parts that you do need to know, and you do need to memorize these. Okay? So to be more broad, cephalic is your head. Cervical, do not confuse this with like cervical cancer. So cancer of the cervix. Cervical means the throat. Thoracic means chest. Abdominal means stomach, and pelvic means groin. Okay? These parts can be broken down into smaller pieces. So facial is the face as a whole. Nasal is nose. Ocular, like binoculars, are eyes. Buccal is cheeks, and we call them that because of your buccal muscle right here. Temporal is your temples, and frontal is your forehead. It's right in the front. Cervical, you have the throat, but then you also have the back of your neck right there is actually called nuchal. Thoracic is chest with your sternal, because this is the sternum. Pectoral is the muscle, so shoulder to sternum, so this region right here. Vertebral is the back, so the spine. And then mammary is breast, like mammary glands. Abdominal, you have umbilical, which is actually your belly button. And lumbar, so if you think of like lumber, so it's like a trunk, lumbar is your lower back. And then pelvic is your groin, but inguinal is the lateral part of the pelvic, so it's kind of like your hips. All right. You also have appendicular body parts. Again, you need to know these. You need to memorize these. The upper arm or the upper limb is your arm, whereas the lower limb is your leg. So easy enough to remember. Upper limb, lower limb. The upper limb, however, does have different terms that you need to know. You need to know acromial, axillary. So if you take an axillary temperature, you're taking an armpit temperature. Brachial is this part right here. Okay, it's your upper arm. Cubital is your elbow, and antecubital is that little divot in your elbow on the front side, or on the technically the back. Antebrachial is your forearm, and carpal is wrist. Manus is hands. Palmar is here in the palm, and carpal is actually the wrist itself. Okay, so manus, oh, we have carpal there. The lower limb, femoral is your thigh. Coxal is your hip. Patellar is knee, named so because of the patella bone, which is your kneecap and your patella tendon. Crural is leg, so that's like your like calf area. And then tarsal is ankle. pedal, like you're riding a bike and you are putting your feet on the pedals. So pedal is foot. Plantar surface is the sole of your foot. Calcaneal is heel. And it's named so because of the calcaneus bone. Okay. So here is just a picture showing those different regions. If you need something to help study, you will also get a copy of a worksheet that we will do, and it'll help label all of that fun stuff. All right, the last kind of section to talk about here are what are called body planes and sections. So whenever we say that we are going to make a type of cut or we are going to create a type of plane, we don't ever use the term like left to right or up to down because it's being very, it's not being very specific. So we want to get as specific as possible. So if I ask you to make what's called a sagittal plane or a sagittal cut, it is a cut that goes from either inferior to superior or superior to inferior. But if you go all the way through the specimen, it will split it into a left and a right section. Okay, so sagittal means that the cut will go this way, but if you go all the way through, it'll split it into a left and a right. You actually have two types of sagittal planes. You have median and parasagittal. Median means it is 100% in the middle. You can also call this a mid-sagittal. Parasagittal means it would be off to the side a little bit. Frontal plane, again, this is one that it's a frontal plane. Technically with this cut, it will go from lateral to lateral, so it'll go lateral, medial, lateral. But if you cut it like this, it would actually split the specimen into a front and a back. And then transverse will go from like left to right, but it will go this way, and then it will split it into a top and a bottom, or an inferior and a superior. Okay, so if we look at these images, and we will look at these again more in class. In this picture right here, we see shoulders. Here is their humerus bone. Here is the lungs and the heart in the middle. You can see a stomach. You have a liver over here. So this plane would be this one. Let me actually draw it out here. This one is actually referring to this plane right here. Okay, because it is splitting the specimen into her front half and her back half, so you're able to see kind of in the middle of that. Okay. This one here, you can see here is the spinal column, or the spinal, or excuse me, the spine. You have some belly up here. Okay, you also have the rib cage is going to be, oh, sorry, excuse me, the rib cage is right here. So this one is actually this plane right here, because it is splitting her into a left and a right. Okay. And then the last plane, again, these are easier to read if you kind of know what you're looking for, but this one you have some ribs here, and then you can see the spine right here, and then you have some internal organs in the middle. So this one is this transverse plane, because it is splitting her into a top and a bottom. Okay, so that is it for the anatomical terminology notes and directional terminology notes. So make sure you have those copied into your notebook and bring them to class ready to go when I see you next.